My name is Patrick Schumann, and today I'm going to be demonstrating the piggyback. The drug I'll be using is vancomycin. It's an antibacterial. Recommended dose is 500 milligrams, Q6 hours. The side effects of that would be ototoxicity, nephrotoxicity, nausea, vomiting, and phlebitis. The doctor's orders are for 500 milligrams, and I have 250 milligrams per milliliter, therefore I will be using 2 milliliters. I would clean using antiseptic technique. I would double check my doctor's orders along with the MAR, make sure I have the right medicine and the right dose and the right patient. I would then draw up 2 milliliters. And then again, I would draw back 2 milliliters, excluding air bubbles. I'd be then ready to administer the medication to the bag. So I would clean the port and administer.
Okay, now I'm going to administer the medication.
After administering the medication, I would dispose into the sharps container, and then I would label my bag. I would put the patient's name, the date, the dosage, my initials, and the medication. Now that the bag is ready, I'm ready to open my tubing. I would check the integrity of the package and the expiration date. Once that was verified, I could open it.
Alright, Mr. Williams, I'm gonna come back and check on you about an hour just to make sure that the infusion is done, okay? Okay.
I would then be able to attach the tubing to the medication.
Alright, I'm gonna come back. Mr. Williams, I'm back. Just looking at your socks.
After attaching the tubing, I would then label the tubing with my name, the date, the medication, the route, and the patient. Alright, so now I'm ready to enter the patient's room. After entering the room, I would identify myself, ask the patient to identify themselves I would look at their wristband and ask them to state their name and date of birth. After establishing that, I would perform hand hygiene and put on my gloves. After applying my gloves, I'm ready to hang the bag. I would put the piggyback up and lower the big bag. After hanging the bag, I would prime the line to about halfway and make sure there's no air bubbles.
My patient does not have a PICC line, so I will not use that today. That will only be indicated for a PICC line on their physician orders. Alright,
once I've done that, I'll go to the patient. I'll check for any tenderness, redness, or inflammation.
Alright, this concludes this video. I'm going to document using my MAR.
I would then clean the port.
If I were you, I would just include that in the email. Because you started.
And attach my line.
You started saying what you want to document, you just running out of time. So
after attaching my line, I would first clamp both here and here of the primary line. After clamping the primary line, I would unclamp the piggyback. Also unclamp the connection. And I would set my drip factor. My drip factor for this medication is 6 drops per minute.
So you wanna go downstairs right? Yeah.
After establishing the drip factor, I would recheck my site, ask the 4 Ps for the patient, double check my tubing, and I would be okay to leave the room. So I would later come back to the room, I would perform hand hygiene and apply my gloves again. I would then introduce myself again, just to be safe, and identify the patient again. Once this medication has stopped, I'm okay to take it off. So I would clamp this line and clamp the connection. And then I would unclamp the primary line. And then unclamp the connection. Now that this is clamped, I'm good to take this off. I would disconnect this. I would take the tubing off of the bag and clamp this with an alligator clamp. I would double check my primary line to make sure it's setting at the right drip factor, that it's unclamped, and that the site still has no irritation, tenderness, or irritation, or kinks in the tubing. Once that is set, I would check the patient's, the 4 Ps, the position, the pain, the possessions, and the position. And then I would document the medication, the label, the site, how the patient tolerated it, where it is, the primary line as well, and the mini bag, the condition, and I would double check it with my MAR, and I would be good to go.